Welcome back to this next video in which we are studying headaches. Okay, so in this next video we're now going to look at another infectious cause of a type of secondary headache, and this is going to be sinusitis. So, sinusitis literally means inflammation of the paranasal sinuses. So I'll just write this down here. The paranasal sinuses are going to be the stars of the show for a while. So these are air sinuses that are parallel to the nasal cavities, and indeed they are joined to the nasal cavities by little tubes. And the first thing we will do is go over the anatomy of the paranasal sinuses in just a moment. So, inflammation of the paranasal sinuses is called sinusitis, and this is usually going to occur because of viral infection of the epithelium of the paranasal sinuses. Now, because the paranasal sinuses come off the nasal cavity, this means that this can occur reasonably commonly. So remember, we've just discussed meningitis as an infectious cause of a headache. That is an extremely rare infection, and it's an extremely dangerous infection. Sinusitis is a far more common infection for someone to get as a complication of a respiratory tract infection by a virus, so for instance a cold or flu, and it's nowhere near as dangerous as meningitis. So, the way that I want to discuss sinusitis is I want to start by going over the anatomy of the paranasal sinuses just to make sure everyone knows what the paranasal sinuses are and where they are. Then I want to go over the anatomy of the innervation of the paranasal sinuses so that we understand how they're going to be innervated with pain sensation. And then I want to go to the pathology. We'll discuss what can infect the epithelium of the paranasal sinuses, how this will lead to inflammation and therefore lead to a headache. And then finally we'll end up just discussing the treatment. Right. So, sinusitis then. So, to begin with, paranasal sinuses. So for this, let's do a little picture of the skull again. So we're going to do another bit of anatomy, more background anatomy. So I'm going to draw another picture of the skull, and again this picture is going to be from the front. So I'm going to draw a picture of the skull from the front. So we've drawn this picture before, I'll just copy it out again. So here is the forehead portion of the skull, like so. Then let's put on the zygomatic arches, like so, and this is the way I like to draw the zygomatic arches. Then the rest of the maxillary bone, like so, and then we'll have the teeth in this position here, like so, and I'll just put in the teeth. And I'll put them in very crudely as previously, rather than actually trying to get the anatomy of the teeth correctly. Okay, so that represents the teeth. And then of course we need to put in the mandible. So here is the ramus of the mandible, and then the body of the mandible coming forward like so, and then the left-sided ramus of the mandible as well going up between the zygomatic arch like so. And of course we need to put the inferior row of teeth in as well, in this position here. Okay, right, so there are the teeth. Then of course we need to put in the orbital cavities, so here is the right orbital cavity, and here is the left orbital cavity. And now the bit that we're really interested in, of course, is the nasal cavity and then the paranasal sinuses, so I'll put the nasal cavity in here, like so, and of course the nasal cavity is actually two separate cavities split with the nasal septum here. So here's the left nasal cavity and here's the right nasal cavity. Okay, so here's our basic picture of the skull from the front. So the paranasal sinuses, there are actually 8 of these that come in 4 pairs. So there are 4 pairs of paranasal sinuses. So if you're ever asked how many paranasal sinuses are there, say there are 4 pairs. So overall there are 8 separate paranasal sinuses, and these are air sinuses. They're full of air and they're connected to the nasal cavity, and we're going to firstly have a look at where they are present, and then we'll have a look at how they're actually connected to the nasal cavity. So let's go over the 4 pairs then. So first pair is the frontal sinuses. Now these are actually present in the forehead portion of the bone here, the frontal bone, and you've got one on either side. So this piece of bone here that makes the frontal region of the skull, it is not a solid piece of bone. It's hollow. If you were to drill through it to try and get into the anterior cranial fossa, you would firstly go through a layer of bone, then you would go through a layer of air, and then you would go through an inner layer of bone, and then you would hit the periosteal dura mater that lines the anterior cranial fossas inside. So this bone is actually hollow, and it contains an air sinus. Okay, and this is on either side, so I'll put these in here. So in these kind of positions, and obviously I like to draw things, humans like to draw things in very simple shapes, so I'll nicely show it in a rectangular shape here. It's in a more complicated shape than that, but this captures the basics of it. So here is the pair of frontal sinuses. So we have the left frontal sinus here and the right frontal sinus here, and they are separated by a portion of bone, so you can't go directly from the right frontal sinus into the left frontal sinus here. And they're going to be connected to the top of the nasal cavity, however, we'll discuss that in a moment. Okay, so those are the frontal sinuses. So they're sinuses within the frontal bone. And then let's have the ethmoidal sinuses. Now the ethmoidal sinuses are a little bit complicated. You're going to have one on either side, and they're going to be in the ethmoidal portions of bone, which are these portions of bone here on the medial sides of the orbital cavity. So to put in the ethmoidal sinuses, and I'll do them in a different colour to the frontal sinuses, we'll do them in pink, they will be in these sort of positions here. However, they're not a simple sinus. They're not like just a great big cavity like the frontal sinuses were. The frontal sinuses were one great big sinus, whereas the ethmoidal sinuses are actually loads of little sinuses that we all refer to as one sinus. They're loads of little air spaces, and therefore we often refer to them as the ethmoidal air cells. So what do I mean by this? I mean that if you look in this position, so if we look at the left ethmoidal sinus here, it's not just one great big sinus, it's actually loads of little sinuses that are separated by bone, and they're all called the ethmoidal air cells, and they're all going to be connected up with a network of tubes to, again, the nasal cavity. And we're going to have two tubes coming off the nasal cavity that are going to supply the ethmoidal air cells, one that supplies the anterior ethmoidal air cells and one that then supplies the posterior ethmoidal air cells. But I'll come back to that in just a moment when we do the tubes. So those are the ethmoidal air sinuses. The next one that I can show on this picture are the maxillary paranasal sinuses, and these are in the maxillary bone. So again, the maxillary bone here, it's not a great big solid lump of bone. If you touch your cheeks, that's not a solid great big piece of bone. Instead, it's hollow. It's got a paranasal sinus in, and this paranasal sinus is fittingly called the maxillary sinus. So at least they are given simple names. So in this position here, there is a paranasal sinus on both sides, and those are called the maxillary sinuses. So we've got the left maxillary sinus and the right maxillary sinus. So we've so far had 3 of the 4 pairs of paranasal sinuses. The final pair of paranasal sinuses I cannot show you on this picture. These are the sphenoid paranasal sinuses, or we can even call them the sphenoidal paranasal sinuses. And these are actually in the sella turcica. So to draw this, I will draw that picture that we have, that you're probably getting fed up of me drawing, the picture of the cranial cavity viewed from above. So here we go, I'll draw it here. So start by drawing an oval, like so, and then we'll have the anterior cranial fossa here. Here are the clinoid processes. Then we'll have the sella turcica, which of course we're very interested in now. There's the chiasmatic groove, and here of course are the petrous portions of the temporal bone and the foramen magnum. So this great big solid lump of bone here that forms part of the floor of the cranial cavity, this of course is where the sella turcica is. The pituitary fossa is present right in the middle there, but this great big lump of bone, that is not, again, a solid lump of bone. Inside that there is a hollow space, a paranasal sinus, and remember you can get into this from the nasal cavity, and I'll show you how you can get into it. The nasal cavities are, remember, underneath here, so they're not far away from where this piece of bone is, so do remember that. So let me mark on the sphenoidal sinuses then. So they're in this bone, underneath of course the pituitary gland, and they're on either side. So you have a left sphenoidal sinus and a right sphenoidal sinus, like so. Okay, so there we go. There are the 4 pairs of paranasal sinuses. Next thing to discuss is how do we actually connect the paranasal sinuses to the nasal cavity. Let's discuss the anatomy of the connections. Then we'll go on to the anatomy of the innervation of the epithelium of the paranasal sinuses. And I should say, the epithelium that covers these paranasal sinuses is going to be the same epithelium that covers the nasal cavity, i.e. a columnar, simple epithelium. So a single layer of very, very tall cells that can produce a mucus that will line their surface. Okay. So, we want to discuss the connections from the nasal cavity to the paranasal sinuses on the respective sides. So, of course, the left nasal cavity is going to connect to the left paranasal sinuses, and the right nasal cavity is going to connect up to the right paranasal sinuses. Now, to discuss where these tubes are, these holes that will lead into the paranasal sinuses, we need to understand about the turbinates, the nasal turbinates, also known as the nasal concha. So we want to discuss the nasal turbinates. Now these are pieces of bone that come off the lateral walls of the nasal cavity, and the purpose of the turbinates is to increase the surface area of the epithelium of the nasal cavity, because remember, the function of the nasal cavity epithelium is when you're breathing in air through the nasal cavity, you need to warm that air up, and you also need to moisturize that air, because you don't want cold, dry air going down into the lungs, because that would damage the lungs. It would suck the moisture out and make the lungs very, very cold and potentially lead to the lung cells dying. So you need to warm up the air and moisturize the air before it can go down to the lungs, and that is the job of the nasal epithelium. So to increase the surface area of the nasal epithelium, we have the turbinates. So let me just draw a little picture of what the turbinates look like from the front, and then I'll do a picture from the side. So let's just take out the right nasal cavity here. So we'll do this just on one side, but the symmetrical image will be true on the other side. So here is the right nasal cavity. The entrance to the right nasal cavity drawn much bigger now. So if you were to look inside here, you do not just see a simple cavity. It's not a simple shape. Instead, on the lateral wall of this nasal cavity, you're going to have extensions of bone coming in. So let me put these in. So here is one of them. An extension of bone that comes, here is its connection to the lateral wall, and it comes out into the middle of the nasal cavity, and then you'll have 2 little passageways you could go on either side of this turbinate, and that one that I've drawn there is the middle turbinate. Then, down here, we'll have another one, and that's going to be the inferior turbinate. And then you do have one right at the top. You might not really be able to see this from the front, but I'm going to mark it on anyway. You'll understand why I'm saying you might not be able to see that from the front. If you look very carefully, you might be able to see the superior one as well. So you have 3 nasal turbinates on either side. The superior nasal turbinate, the middle nasal turbinate, and the inferior nasal turbinate here. And as I say, these are bony projections coming into the nasal cavity from the lateral wall of the nasal cavity, and they're going to be covered in epithelium, and the idea of this is to increase the surface area of the nasal epithelium, because the nasal epithelium performs this task of warming air up and moisturizing it. So, to really get this point across, what I'm going to do is draw another picture. I'm going to imagine I'm a little man, and I'm going into the nasal cavity here, and I'm going to imagine that I can see the entire lateral wall of the nasal cavity so that I can show you the turbinates coming off. So here is this picture now. So again, nice simple shapes. Here is the lateral wall of the right nasal cavity that I am looking at, and I now want to show you the turbinates coming off. So again, I'll start with the middle turbinate. So it comes off and runs in this position here. So I hope you understand. I hope you can put this picture and this picture together. This is the great big piece of bone coming off the lateral wall, and it will be connected right at the top, as is shown here. And then there'll be a tube running all the way behind this, and you could come out at the other end here. Okay, so indeed air can run down there and be warmed up by the epithelium that lines the inside here. So that's the middle nasal turbinate. The inferior nasal turbinate, is just as long. So here is the inferior turbinate, and exactly the same sort of anatomy, connected at the top here, as is shown on this picture, and then it will dangle down, hang down like this. And then the superior turbinate, the reason I said you might not be able to see this from the front is because it's further back than the middle turbinate, so it's in this sort of position here. It doesn't start till much later on back here. Okay, so, but again, it's connected at the top and then it will dangle down as we go downwards. Okay, so superior nasal turbinate, middle nasal turbinate, and inferior nasal turbinate. And the mirror image of this will be true on the left-hand side as well. So on both nasal cavities we have these turbinates, the superior, middle, and inferior turbinates. Now, most of the tubes or the holes off the nasal cavity that are going to connect to the paranasal sinuses come off underneath the nasal turbinates. So let me mark some of these on. So let's start with the ostium for the maxillary sinus. So that's a good word. Ostium means hole. It's another word for hole, like foramen. And for some reason, instead of using foramen here, when we're talking about the holes to go into the paranasal sinuses from the nasal cavity, we use ostium. So let's start with the ostium for the maxillary sinus. And of course, everything we're doing will be on the right-hand side. So this is going to be underneath the middle nasal turbinate in this sort of position here. So if you went underneath the middle nasal turbinate a little way along, you'd then be able to enter a little hole if you were a very little man, and you'd be able to go into the right maxillary sinus. So that is the maxillary sinus ostium. Next, the next one along that I'm going to discuss is also underneath the middle nasal turbinate, and it's going to be in this sort of position here. And that's going to go into the ethmoidal air cells, and it's going to go into the anterior ethmoidal air cells. So remember, I said there are lots of little air cells in the ethmoidal sinus. They're going to be connected by tubes. Here is one of the tubes coming off. It will branch off, it will separate into branches, and these different branches will supply anterior ethmoidal air cells. So I might just label that up. So this ostium here in pink, this is anterior ethmoidal air cells that's going to supply with air. So anterior ethmoidal air cells. So this is a connection into the anterior ethmoidal air cells. So that means we also need a connection for the posterior ethmoidal air cells, and that's going to actually come off from underneath the superior nasal turbinate, so in this position. So again, to get into there, you'd have to go underneath the superior nasal turbinate, and then you'd find this ostium, and if you went in that, you'd get into a tube which would branch off, and those tubes would go into the different posterior ethmoidal air cells. So I'll just label this one up. This is going into the posterior ethmoidal air cells, and I won't write ethmoidal air cells out again, I'll just put post there. Right. Next, how are we going to get into the sphenoidal air cells? So the sphenoidal air cells, the connection into the sphenoidal air cells is also going to come off underneath the superior nasal turbinate in this sort of position here, behind the ostium for the posterior ethmoidal air cells. So again, underneath the superior nasal turbinate, go underneath here, you'd find an ostium, and if you went through that ostium, you'd get into the right sphenoidal air sinus. Okay, so one final one, excuse me, one final one to discuss is how are you going to get into the right frontal sinus. So this is the only one that doesn't come off underneath the nasal turbinates. This is actually going to come off from the roof of the right nasal cavity, so I'll draw this in here. So from the roof of the right nasal cavity, and of course it's quite far back, so on this picture it would be in this position maybe. Okay, once you're actually reasonably well within the bone, will come the connection that takes you up to the right frontal paranasal sinus. Okay, so there we go. There are all the connections from the nasal cavity into the paranasal sinuses, and of course we've discussed this for the right nasal cavity and the right paranasal sinuses, but the symmetric pictures would be true for the left nasal cavity and the left paranasal sinuses. Okay, so let's now discuss the innervation of the paranasal sinuses. So all of these paranasal sinuses, these are going to be covered by the same epithelium as lines the nasal cavity, and this epithelium is going to be innervated with pain neurons, and we now want to see how are those pain neurons actually going to get into the central nervous system. Of course, those primary nociceptive afferents will come in to synapse in the trigeminocervical complex. The question is, which parts of the trigeminal nerve are they going to come in? So they are indeed going to come in the trigeminal nerve rather than in the first three cervical spinal nerves. So we now want to see the branches of the trigeminal nerve that is going to innervate these. And it's going to be branches from the ophthalmic division of the trigeminal nerve and the maxillary division of the trigeminal nerve. So we'll start off with the branches from the ophthalmic division of the trigeminal nerve. So again, this is going to involve redrawing some of the pictures that we saw earlier, and we'll do it all for the right-hand side. Since we've been doing the right-hand side all along, we'll stay with the right-hand side. So I'm going to draw another picture of the ophthalmic nerve coming into the orbital cavity. So remember, the ophthalmic nerve comes off the trigeminal ganglion, runs in the roof of the cavernous sinus, and then will go into the superior orbital fissure by penetrating through those outer layers of meninges. And then in the orbital cavity, it's going to split into three major branches: the frontal branch, the lacrimal branch, and the nasociliary branch. So let me draw this here. So this is representing the right orbital cavity viewed from above. And we've drawn this picture before, so we're imagining we've cut out the bone here and we can see the top of the right orbital cavity here. So here, in red, this is the right eye. So, thicker pen at the ready then. So here comes the ophthalmic nerve coming in here, so this is V1. And then it splits into, as I've just said, the lacrimal branch, the frontal branch here that will remain superior, and then a branch that goes downwards and remains medial called the nasociliary branch. Whoops, and I've managed to put in a horrible line there. Okay, so thinner pen back. So we now want to discuss some additional branches of the nasociliary nerve. So the one that's going to be very important for me at the moment is the nasociliary nerve, because this is going to supply the anterior and posterior ethmoidal air cells and the sphenoidal air sinuses with nociceptive innervation, and I want to discuss how. So let's remember what we've previously said about the nasociliary nerve. So of course the nasociliary nerve gives off branches into the ciliary ganglion and also the long ciliary nerve. We're not interested in those at the moment. Those, remember, go into the eyeball. The bits that I am interested in is the anterior ethmoidal nerve that comes off the nasociliary nerve, and I now need the thick pen back. So let me extend this up. So remember, one of the final branches is the infratrochlear nerve, but before we get the infratrochlear nerve, we give off the anterior ethmoidal nerve here, which goes into the anterior ethmoidal foramen, which is a hole in the medial wall of the orbital cavity, and it ascends up, remember, into the olfactory groove in the anterior cranial fossa. Now, a new piece of information is that we don't just have an anterior ethmoidal nerve, we also have a posterior ethmoidal nerve, and that's the one that I've just added on here. So let me label these up. So this one here, this is the posterior ethmoidal nerve. This is a new one. I have not told you about this one previously. I only previously told you about this one up here, which is called the anterior ethmoidal nerve. So you might have wondered, why did we call it the anterior ethmoidal nerve? Well, here's the answer. There's also a posterior ethmoidal nerve. So the anterior ethmoidal nerve goes for a foramen called the anterior ethmoidal foramen. The posterior ethmoidal nerve goes for a foramen called the posterior ethmoidal foramen. Again, new information here. So there are these two foramina in the medial wall of the orbital cavity, the anterior and posterior ethmoidal foramens. Okay, and these ascend up in the medial wall of the orbital cavity, both into the olfactory groove. So, going back to this picture up here, so let's mark on the olfactory groove. So here is the right olfactory groove, and here is the left olfactory groove, separated, of course, by the crista galli. Now, remember, the anterior ethmoidal nerve comes out into the right. It comes out into the olfactory groove, and if we're talking about the right side, it will come out into the right olfactory groove. And then it goes through the nasal slit at the front of the olfactory groove to get into the nasal cavity to supply the epithelium of the nasal cavity with sensory innervation. It also, remember, gave off the anterior meningeal branches of the anterior ethmoidal nerve, which is why we were so interested in it. Now, I'm now telling you there's also a posterior ethmoidal nerve. This comes out again in the olfactory groove, and it's going to go into the nasal cavity finally as well. So you might expect it to go forward to the nasal slit as well, but it doesn't. It sends its branches through the cribriform plate, which, remember, is the bottommost floor of the olfactory groove, the plate with loads of holes in it through which the olfactory nerves come through. However, now the posterior ethmoidal nerve branches are going to be going the opposite way to then innervate with normal general sensory innervation at the top of the nasal cavity epithelium. They're not involved in sense of smell. Okay, so that's a little bit of background about the posterior ethmoidal nerve, where it's going to come out. It will come out in the posterior ethmoidal foramen, which is further back in the olfactory groove than the anterior ethmoidal foramen. In fact, I might even mark these on. So remember, the anterior ethmoidal foramen came out around here in the olfactory groove. Posterior ethmoidal foramen is going to come out further back. And the anterior ethmoidal nerve, just to say it again, goes forward to the nasal slit to get into the nasal cavity. Posterior ethmoidal nerve goes through the cribriform plate, and they're both general sensory innervation, not sense of smell, to the nasal cavity. Now, this isn't the bit that we're interested in, that's just the final anatomy. Whilst they're going through these tunnels, so whilst the anterior ethmoidal nerve and the posterior ethmoidal nerve are going through these tunnels in this wall, they're going to give branches that are going to innervate the anterior and posterior ethmoidal air cells. And this is very, very simple. Which ones do you think are going to give branches to the anterior ethmoidal air cells, and which ones do you think are going to give branches to the posterior ethmoidal air cells? The anterior ethmoidal nerves, they give branches, sensory branches, to the anterior ethmoidal air cells, and the posterior ethmoidal nerves, they give branches to the posterior ethmoidal air cells on either side. The posterior ethmoidal nerves also give branches that are going to go back to the ipsilateral sphenoid sinuses. So, just writing this on here. Anterior ethmoidal nerve gives branches to anterior ethmoidal air cells. So anterior ethmoidal air cells. So this is where the nociceptive innervation for the anterior ethmoidal air cells is going to come in through the anterior ethmoidal nerve, which is a branch of the nasociliary nerve, which is a branch of the ophthalmic nerve. The posterior ethmoidal nerve, this is going to give branches to the posterior ethmoidal air cells, so the posterior portion of the ethmoidal sinus, air cells, and also the sphenoid sinus on both sides, or the sphenoidal sinus. You can call it either the sphenoid sinus or the sphenoidal sinus. Okay, so this is where nociceptive and other forms of general sensory innervation from the ethmoidal air sinuses and the sphenoidal air sinuses is going to come in the ophthalmic division of the trigeminal nerve into the trigeminocervical complex if we're talking about nociceptive innervation, or into the trigeminal sensory nucleus if we're talking about other forms of general sensory innervation. Next, let's now talk about the innervation of the frontal sinuses, and this is also done by the ophthalmic division of the trigeminal nerve, so that's why we'll go on to this one next. So, remember, the frontal nerve, this other branch of the ophthalmic nerve that I'm extending here, it goes forward and splits into two branches here, the supratrochlear nerve, this one here, and the supraorbital nerve, and these both go onto the forehead, so they'll go into these regions here, so I'll put them on. So here is the supratrochlear nerve, and here is the supraorbital nerve. So they supply the forehead, soft tissues of the forehead, with general sensory innervation. Now, branches from those nerves, from the supraorbital and the supratrochlear nerves, will actually penetrate through the bone of the frontal bone into the frontal sinuses. So, what I am telling you is there are little holes in this front portion of bone through which nerves can pass to get into the frontal sinuses. So it is actually the supraorbital, sorry, that pointed to the wrong one, the supraorbital and the supratrochlear nerves that are responsible for innervating the frontal sinuses. So of course on the right hand side, the right supratrochlear and the right supraorbital nerves will innervate the right frontal sinus, and the same on the left hand side, but for the left supratrochlear and the left supraorbital nerves now. And those are both branches of the frontal nerve, which is a branch of the ophthalmic division of the trigeminal nerve. Okay, so that's innervation of the frontal sinuses. And now finally the maxillary sinuses, and because I didn't want to have to redraw out that really complicated picture, look what I have copied and pasted from a previous video. So, the maxillary sinuses are actually shown on here. Here is the left maxillary sinus, and I'm afraid we now move from talking about the right-hand side to the left-hand side, because this picture is of the left-hand side here. So, These are going to be innervated by primary sensory afferents that are going to run in the maxillary division of the trigeminal nerve, 5B here. Okay, so how are they going to come in then? So it's going to be branches from the infraorbital nerve and also these anterior and middle superior alveolar nerves. So let me just remind you about the anatomy of the maxillary nerve. So here comes the maxillary nerve into the pterygopalatine fossa here. And remember, one of the first branches it gives off is the zygomatic nerve, which goes up through the inferior orbital fissure and then splits into the that's the zygomaticotemporal nerve, and then the zygomaticofacial nerve, which go through two foramina to come out on the surface of the skull here. Another branch it gives off is the posterior superior alveolar nerve, which goes through the alveolar foramen here and will innervate the posterior superior teeth. Then the rest of it continues through the inferior orbital fissure, runs through the infraorbital groove, and then goes through the infraorbital canal to come out of the infraorbital foramen here, and then becomes the infraorbital nerve. So this is the infraorbital nerve. Whilst it's running through the infraorbital foramen, it gives off the anterior superior alveolar nerve and the middle superior alveolar nerve, which run through the maxillary sinus like so. So it is branches from the infraorbital nerve itself and the anterior and middle superior alveolar nerves that is going to innervate with general sensory information, and of course we're particularly interested in nociceptive innervation, the maxillary sinuses on either side. Okay, so there we go, that's all of the innervation of the paranasal sinuses. So, background anatomy done. We know what the paranasal sinuses are, we know how they're going to be innervated with nociceptive innervation. Now let's do the pathology. So, the paranasal sinuses are lined by the same epithelium as the nasal cavity, and the nasal cavity is lined by the same epithelium that lines a lot of the respiratory tract, the same epithelium that lines the bottom part of the larynx, the trachea, the bronchi. All of this epithelium, the airways of the lungs, it's all the same. So the nasal cavity has the same epithelium as the bottom of the larynx, which has the same epithelium as the trachea, which then has the same epithelium as the airways within the lungs. Okay? And now the paranasal sinuses have this same type of epithelium, and it's a simple columnar epithelium that's often referred to as a respiratory epithelium. So, the paranasal sinuses, therefore, are at risk of being infected by the same viruses that can commonly affect the respiratory tract. And of course, the common viruses that can affect the respiratory tract, these cause colds and the flu. So remember back to the viruses that I have told you which lead to colds and flu. I'll just remind you. So we have discussed rhinoviruses now in more detail when we discussed meningitis. They were forms of enteroviruses. So rhinoviruses are common causes of colds. They can infect this respiratory epithelium. They go inside the respiratory epithelial cells, these simple columnar cells, and they use the cell to make thousands of copies of the virus particles, which then escape from the cell. Other common causes of colds are coronaviruses. So again, they cause colds. The viruses that cause flu are the influenza viruses generally. Now, remember what the difference clinically between cold and the flu is. In a cold, you get the respiratory symptoms, so you get a runny nose, you get nasal congestion, you get a sore throat, you get a hoarse voice, you get a cough, all of those sort of symptoms, and a sneezing, of course, as well. All of those symptoms are the respiratory symptoms. They're the local symptoms because the respiratory epithelium is infected, and they're to try and help deal with the infection. However, in flu, you get those as well because it's the same epithelium that's infected, but you get much more severe systemic symptoms in flu. So the systemic symptoms are things like feeling unwell, feeling tired, having a fever, having a tension-type headache, having muscle aches. All of these are systemic symptoms of inflammation occurring somewhere in the body. And in flu, you're going to get far worse systemic symptoms of inflammation than you get within a cold. So in colds, generally, you don't get anywhere near as bad systemic symptoms of inflammation. And remember, I've given you the explanation previously as to why that is. It's because the influenza viruses, when they infect the respiratory epithelial cells, they cause much more damage generally. They lead to the cells dying much quicker than the cold viruses. And when cells die, that causes massive inflammation. And the more inflammation you get, of course, the more inflammatory mediators you get going into the bloodstream, and therefore the worse systemic symptoms you get. Okay, so these different types of viruses are the common types of viruses then that can infect the respiratory tract and indeed can infect the nasal cavity. So when you get a viral respiratory tract infection, one of the complications that can occur is it can go into the paranasal sinuses and therefore lead to sinusitis, inflammation of the epithelium of the paranasal sinuses. And of course, when you get inflammation occurring in the epithelium of the paranasal sinuses, this is going to cause pain. It's going to activate those nociceptors that innervate the epithelium of the paranasal sinuses. And again, the major culprit is going to be prostaglandin E2, the major cause of inflammatory pain. So wherever you get inflammation occurring, you get prostaglandin E2 being produced, which can activate the nociceptors there and therefore will lead to pain being experienced there. Okay, so just to summarise what I've told you about the pathophysiology so far. So these common viral infections of the respiratory epithelium, rhinoviruses and coronaviruses which lead to colds, and influenza viruses which lead to the flu, they, as a reasonably common complication of the respiratory tract infection, can go into the paranasal sinuses and cause infection of the respiratory epithelium that lines the paranasal sinuses. And this is not too uncommon. In fact, let me give you some statistics. It's estimated that in about 20% of people, so 1 in 5 people in a year, will get a respiratory tract infection that has sinusitis as a complication, so where the virus actually does go into the paranasal sinuses and causes sinusitis. So this is not uncommon. This does occur to a lot of people every year, but it doesn't occur in every cold or flu you get. So this isn't a complication that you will always get. So when you usually get a cold, it doesn't usually go into the sinuses. It's just not too uncommon that it can go into the sinuses. Or if you get flu, not necessarily all of the flus that you get, it will cause sinusitis, but in some cases it will cause it. So it's not an uncommon thing to occur when you get a viral respiratory tract infection, and it is nearly always viruses that cause sinusitis. So, when you get the virus infecting the epithelium of the paranasal sinuses, it will cause inflammation there. You'll get prostaglandin E2 being produced there, which will activate the nociceptors that innervate the paranasal sinus epithelium, and therefore you'll get pain there. So let's now discuss what type of headache you're actually going to get. So, typically, the headache that you feel, it will start off as unilateral and then it might spread to being bilateral. So let's do a description down here. So firstly, the site. It's usually going to be unilateral initially because it's usually just going to be one of the paranasal sinuses on one side that is actually going to be infected initially, and then it can often spread to being bilateral as the other paranasal sinus on the other side is going to be affected. Now, where is the pain actually going to be? Well, of course, it will depend on which paranasal sinuses are actually affected, and the pain will be felt around the paranasal sinuses. So if the maxillary paranasal sinuses are infected, of course, you'll feel the pain in the cheeks. If the ethmoidal paranasal sinuses are infected, you'll feel it around the eye. The frontal sinuses, again, you'll feel it in the forehead region and around the eye. Remember which of the divisions of the trigeminal nerve innervate it will be important here. The ones that are innervated by the trigeminal nerve, you will feel those in the trigeminal nerve's jurisdiction, whereas the ones that are innervated by the maxillary nerve, the maxillary sinuses here, you'll feel those in the maxillary nerve's jurisdiction, which is of course the cheeks. So generally, if the frontal, ethmoidal, sphenoidal air sinuses are infected, you'll feel that in the frontal and periorbital regions, the trigeminal nerve's jurisdiction, whereas if the maxillary sinuses are infected, you'll feel that in the cheek region, the maxillary nerve's jurisdiction. So, it usually starts being unilateral and then it will go to becoming bilateral. It will be in either the jurisdiction of V1 or V2, depending on whether we're talking about the ones that are innervated by the ophthalmic division or the maxillary division of the trigeminal nerve. And again, remember that's because of convergence. These primary nociceptive afferents that innervate the paranasal sinuses, they're going to be synapsing onto the same second-order neurons as the other primary nociceptive afferents that come from muscle tissue and other peripheral tissues that are carried by that same division of the trigeminal nerve. So just like we study convergence in the case of the meningeal nociceptors, it's also going to happen with the paranasal nociceptive afferents as well. So it'll either be in the ophthalmic area or the maxillary area, depending on whether we've got infection in the frontal, ethmoidal, and sphenoidal sinuses, which are ophthalmic, or maxillary sinuses, which are maxillary. Okay, so that's the site. The severity is going to be mild to moderate. It usually doesn't get too severe. Okay, and it won't be pulsating because, of course, these nociceptors aren't going to be surrounding arteries in the same way that the meningeal nociceptors are surrounding arteries. Okay, so that's a little bit of a description of the headache that you get in sinusitis. So it generally does start unilaterally and then go bilaterally as the other paranasal sinus on the other side becomes infected as well. Finally, let's just say something about the treatment for sinusitis. You should be able to guess. We've got inflammation causing the pain, so prostaglandin E2 is of course extremely important in the pathophysiology, so we will want to give the drugs that can stop the production of prostaglandin E2, and we know what those drugs are. They are the NSAIDs, the non-steroidal anti-inflammatory drugs, and again, recite them off at your computer screen. Aspirin, ibuprofen, diclofenac, indomethacin, and naproxen are the key examples, and of course also paracetamol can reduce the production of prostaglandin E2, although we're not completely sure of the mechanism for that, also called acetaminophen. Now, with regards to whether you need to do anything about the viral infection, the answer is no. The immune system, the adaptive immune system, will kick in and will annihilate cold viruses and the flu viruses. Unless you are immunosuppressed, you do not need to be worried about cold viruses or flu viruses. They will be dealt with by the adaptive immune system. So really, the drugs that you should take if you've got sinusitis are just for symptomatic relief. You don't need to take drugs that are actually going to help bust the infection. The adaptive immune system is perfectly capable in most healthy people of destroying cold viruses and the flu viruses. So, overall, sinusitis is inflammation of the epithelium of the paranasal sinuses, and it's caused by usually viral infections of that epithelium, and the viral infections that can cause it are usually the same viral infections that can infect the respiratory tract, and usually sinusitis arises as a complication of a cold or the flu. So you get a cold or the flu, which is a viral respiratory tract infection, and sometimes, not too uncommonly, it can then go into the paranasal sinuses, and usually this will trigger a headache that will start unilaterally and then become bilaterally, which is how you can kind of distinguish between sinusitis and just the tension type headache as the systemic symptom of the inflammation occurring in the respiratory tract epithelium. And you don't need to take treatment for the actual viral infection. Usually, in most people with a healthy adaptive immune system, you will fight off the virus successfully, and therefore you can treat this just with symptomatic treatment, the NSAIDs and paracetamol, which will reduce the amount of prostaglandin E2 being produced, and therefore reduce the activation of the nociceptors innervating the paranasal sinus epithelium, because it's the prostaglandin E2 that is responsible for the inflammatory pain. Right, so it's helpful that actually the treatment here is the same sort of treatment as we would give to abort tension type headaches. So really it doesn't matter whether you're debating if this headache that you've got with the flu is a tension type headache caused as a systemic symptom of inflammation, or if it's actually sinusitis. The treatment is the same. Treat it with NSAIDs and paracetamol or paracetamol. Okay, so we'll have a break here, and in the next video we'll discuss trigeminal neuralgia.